Hello, and welcome to the APhA-ASP Women's Health Campaign Outstanding Chapter presentations. I will now turn it over to our chapter leader from the University of New Mexico College of Pharmacy.
Hello, my name is Vanessa. I will be representing the Women's Health Initiative for the University of New Mexico. I was the chair of this initiative for the past year. Before I get started, I want to thank Merck for all of their support. And now to begin, what I will be covering in this presentation is how to incorporate contraceptive education and awareness into your women's health campaign activities, the description of UNM's outreach day across our state, and how the Women's Health Initiative plans to continue our momentum and growth. This question is just something to keep in mind throughout this presentation, and that is what student pharmacists do to educate others and increase awareness around women's health. So, contraception, education, and awareness was a huge part of the events our campaign participated in. We partnered with Beyond the Pill. They have been a huge resource to us. They helped us to create a presentation that's an up-to-date and accurate overview of the different contraceptive methods, including emergency contraceptive. I was able to attend a free in-person presentation by them to understand the best practices in contraception, long-term reversible contraception, and counseling techniques. It was really helpful for us to get all this information they were able to provide, as well as understanding how to talk to patients and help them find methods that work best for them. Some of the challenges that we faced when trying to incorporate this information was, first of all, being able to get into public schools. It was really important for us to be able to use our connections. So whether that be knowing a teacher in a certain school or being able to tag along with one of the other initiatives that already had a presentation going on in a school. It was also hard for us to make the presentation interactive. We really didn't want to make it feel like it was just a lecture. So being creative and helping the audience get engaged could be challenging at times. And lastly, making the presentation representative to all genders. Each of the classrooms that we presented to this year did have a variety of people in them. So having topics that were able to relate to everyone in the audience could be challenging. To overcome that, we kind of touched on STDs and the Gardasil shot, different topics like that more people could relate to. What we learned when giving these presentations was that we received a lot of different questions, and that kind of just sparked the idea that there is a lot of misinformation out there, but it made us really helpful because we felt like we were making a really big impact by bringing this accurate information and being there to dispel those myths. And one really important thing, if you see on the slide, that screenshot in the center is actually what the last slide of our presentation looks like. So it was really important for us to be able to provide a trusted resource or resources, just so we didn't feel pressured like we had to have all of the answers to everyone's questions. And this slide is just kind of the methodology for us to coming up with new events. So for example, in the fall semester, we would look ahead at the upcoming months, and we knew that October was Breast Cancer Awareness Month. So to kind of find a way to get involved and do something that semester, we reached out to the American Cancer Society because they do a Making Strides walk every October for Breast Cancer Month. So we reached out and we asked if there's any way we could get a group of pharmacy students to help support that event. Similarly, with Cervical Cancer Awareness Month in January, this time we just did like a Facebook post, and we just try and do something to keep us going and getting involved. So for May always has Women's Health Week. So last year we were able to do a virtual 5K. We partnered with Vitamin Angels, and they donated part of the proceeds to deficient women and children. And then for our presentations, we just keep trying to adapt and gear our presentations toward our audience. And one way we do that, like for the sororities, was we just reached out and asked them which women's health topics they would like us to cover. Okay. And Outreach Day is a great, we're very lucky that our school gives us off a Friday in October, which is American Pharmacist Month, to be able to go out into the community, provide education and health services to the community. Some of the health services include providing screenings or vaccines. So this year, the Women's Health Campaign was able to reach over 100 New Mexicans. And we did this by going to New Mexico State University, the Corbett Center. We had a tabling event there. On UNM's main campus in the Student Union building, we were able to do a tabling event, as well as a presentation to a women, gender, and sexuality class that day. So it was a great opportunity for us to reach the community and teach everyone about what pharmacists and pharmacy students are able to do. So looking forward, we want to continue our interactions with young women in middle school and high school. So one of our ideas was talking about skincare, anti-acne products, non-comedogenic products, and sun protection. We got this idea based on our self-care class, which covers a lot of over-the-counter products. And since we have our professors and we're close with our professors that teach that course, it's a great resource for us to be able to build a presentation, having their knowledge and giving it a nice topic that a lot of young women can relate to. We also plan to continue to adapt our presentations, and one of our main motivators is being able to reach sexual and gender minorities. So right now we're really trying to think of ways that we can reach transgender women with HIV prevention. It's really important that we try and support gender and sexual minorities for that. And also on our North Campus, a new Women's Resource Center has just opened up, and they plan on touching on sexual abuse topics, self-care topics, just trying to provide childcare services for students on North Campus. So we don't know exactly what that partnership will look like yet until they get up and running 100%, but we're really excited to try and team up with them and be able to reach more students and provide more resources. And with that said, thank you for your time. If you have any questions or want more information on anything, including incorporating any of these events, or thinking of new events for your initiative, feel free to reach out at the website below. And thank you for your time.
This concludes the presentation. Thank you very much for joining us.